But a new study finds women may have a higher risk of getting breast cancer after giving birth compared to women who do not have children. Thanks for joining us at 5:30. I'm Jerry Revish.
I'm Tracy Townsend. So we want to break down the headlines of this story. Birth could mean a higher risk of breast cancer. Researchers say the risk, though, doesn't last for long. Women who have babies may face a greater risk of breast cancer compared to women who don't have children. Researchers from the University of North Carolina found the increased risk lasts for decades from the time of the woman's last child.
It's highest 5 years after the child is born, and it continues to 24 years, and then it starts to fall.
34 years after childbirth, the risk of breast cancer actually goes down 23% for women who've given birth. Doctors say that's an important point since most breast cancers happen in women over the age of 60.
So if you look cumulatively, it decreases the risk because breast cancer is relatively rare in young women.
The study also found the increased risk of breast cancer after childbirth was higher for women who were older when they had their first child, for women who also had a family history of the disease, and for women who had a higher number of births.
This does change our screening criteria. And now we're going to ask, when was your last child, when we determine your risk to determine if you should be screened or not.
Researchers say breastfeeding did not impact the results either way. Health experts don't know why the risk goes up for 24 years after childbirth, but they think the estrogen surge during pregnancy may be a factor. Dr. Natalie Jones, who is the director of breast health at Ohio Health, says the findings in this study are misleading because the increase is very small.
I don't think we should change anything based on this study, and we should still encourage women to have kids and to continue to breastfeed because in the end I think those are both still protective. They do not really over the long term increase a woman's risk of developing breast cancer.
And Dr. Jones says women should follow guidelines from the American College of Radiology and the American Cancer Society, yearly mammograms at the age of 40 and self-breast awareness.